Hi, I'm Dr. Jason Ryan, cardiologist at the University of Connecticut Health Center, and welcome to Heart Talk, Nursing Assistant Module 1, What is Heart Failure? Heart failure means a weakness of the heart muscle. The heart is a muscle, just like any other muscle in the human body, and it beats thousands of times per day to push blood to the organs that require oxygen. If the heart can't do its job for any reason, the symptoms of heart failure develop, and those symptoms include difficulty breathing, swollen ankles, legs, or abdomen. This is a symptom that we call edema, and feeling very weak and tired. Edema is a particular sign of heart failure that you should be familiar with as a nursing assistant. When there's extra fluid in the body, it gets drawn to the lowest level by the force of gravity. Patients who are mobile and can stand will have swelling in their feet, ankles, and legs. Patients who are bedridden and cannot stand will have swelling in their buttocks and abdomen area. And the edema that goes with heart failure has a special feature, which is if you press on the skin, it will leave a dent behind. We call this pitting, and this is what you typically see in patients who have swelling related to heart failure. Heart failure is very treatable in the modern era. Decades ago, it would have meant progressive disease and ultimately death in a short period of time, but that is not the case anymore. Through a combination of medicines, procedures, and surgery, patients with heart failure can live long, healthy, and active lives. Heart failure is also chronic. It requires lifelong treatment. Some patients will think that when they're feeling better, they no longer need to be treated, but that is not the case. Patients who have heart failure will be dealing with the disease in one manner or another for the rest of their lives. Heart failure is also very common. More than 5 million Americans have the disease, and it leads to over 1 million hospitalizations each year. If you're a nursing assistant working at a hospital, you should know that the most common reason for admission to a hospital in the United States is currently heart failure. You should report to your nurse if your patient reports any of the typical symptoms of heart failure. These might include having a hard time breathing, new swelling in the feet, ankles, legs, stomach, or buttocks area, or any increase in old swelling that was previously present. You should also know what abnormal vital signs need to be reported to your nurse. As a nursing assistant, you may be asked to measure the oxygen saturation, heart rate, respiratory rate, or blood pressure. Each of these vital signs has a range that's normal for each particular patient. You should know what that range is, and if you measure any value outside the normal range, you should report it immediately. Weight is one of the most important measurements for patients with heart failure, and nursing assistants are often responsible for obtaining a weight every day on a patient. Measuring the weight every day is how we determine how well a heart failure patient is doing. The weight gives us an indication of how much extra fluid is on the body of a heart failure patient. When the weight goes up, that usually means they're retaining more fluid, and when the weight goes down, it usually means they're getting rid of fluid. So patients need to be weighed every day, and the weight needs to be determined accurately. You should weigh your patient at about the same time every day, on the same scale, in the same amount of clothing, and usually after urinating. You should report any increases of 3 pounds in a day or 5 pounds in a week. These increases are too large to be explained simply by daily mild shifts in weight, and they usually represent extra fluid being retained by the patient. This is a sign that they may be starting to get sicker, and it's something that the nurse needs to know about. Fluid intake and output, which we call I's and O's, is also very important for heart failure patients. Patients take medicines to help them get rid of the fluid on their body, and doctors monitor the ins and outs to choose the right medications. So if ins and outs are not recorded accurately, this can lead to the wrong treatment. Some fluids come with a number on the package indicating how many cc's of fluid is present in that particular drink. However, other times patients will drink out of cups, so you should know the volumes of fluid that are kept in certain commonly used cups at your institution. There are 3 commonly used cups here on the screen just for example, and this can tell you how many cc's of fluid is inside of each one. Here are 2 examples of how to calculate ins and outs for a heart failure patient. In example 1, the heart failure patient takes in 2,000 cc's of fluid over 24 hours. This fluid would come from what they drink for breakfast, lunch, dinner, and snacks, plus any intake they get from intravenous medications. Their output over 24 hours is 1,000 cc's of urine. This would give them an I and O value of 2,000 minus 1,000 or plus 1,000, and we call this positive, meaning that the patient took in more fluid than they put out. In example 2, the patient takes in 1,000 cc's from meals, snacks, and medications. They put out 2,000 cc's of urine. This would give them an I&O value of 1,000 minus 2,000, which is negative 1,000. And we refer to this as a negative I&O balance, meaning the patient has put out more fluid than they took in. Some common errors in recording I's and O's include large weight changes of more than 5 pounds in a day. It's extremely rare for a patient to put on or lose 5 pounds in one day. If you see a change that's this large, you should check for a measuring error. Also, very low volumes of intake and output are particularly uncommon. If you see that your patient has only taken in a few hundred cc's a day of fluid or only put out a few hundred cc's of urine, you should check for accuracy of that recording. So in summary, heart failure is a treatable, lifelong illness. Monitoring the vital signs, ins and outs, and weights will help your heart failure patient, and nursing assistants play a very important role in keeping heart failure patients healthy. Thank you very much.